on February.
Sorry.
That is quite all right. That is quite all right. Again, I'm going to welcome everyone to joining us for the Pinellas Continuum of Care Healthcare Information Session for February 13th, 2024. Let me go ahead and thank all of our COC members and our supporters. We're just so glad that you're here continuing to help us accomplish our mission. And as stated earlier, if you have not done so far, could you please go in and introduce yourselves in the chat? Again, as I was introduced earlier, I am Chair Deborah Fix Sanders from St. Petersburg City Council, and I am standing instead of Ms. Councilmember Kathleen Beckman, who could not be here with us tonight of the City of Clearwater. And we are just so excited that you decided to come and learn a little bit more about COC. Next slide. So as you have before you, you see an agenda. We wanted to start right on time with our welcome and introductions. And going into that, I wanted to, during this evening session, just to kind of let you know that you'll have the opportunity to learn about some of the healthcare services available to people, individuals, families, veterans, seniors, and children experiencing an at-risk or homelessness within the Pinellas Continuum of Care, affectionately known to us as COC. But before we get into that, I thought I wanted to provide a little bit of information to you about COC. So the Pinellas Continuum of Care, as you may know, is a group of service providers, governmental agencies, concerned neighbors, and people with a lived experience of homelessness, all working together with a shared mission. To end homelessness in Pinellas County, COC members play a big role in this mission. So whether members are participating in critical committees of work groups like the Providers Council and Lived Experience Advisory Committees, or volunteering during January's annual point in time count, or electing COC leadership, or just sharing resources with neighbors, the support of our members is critical. With that in mind, please consider joining or renewing your membership in the Pinellas Continuum of Care. Membership follows the calendar year, so renewals begin January 1st. And please also consider joining one of our councils or committees, which is where some of our most important work is done. And I can truly attest to what we do in our committee meetings. So please visit the pinellashomeless.org/PinellasCOC to join or renew your membership and to view the COC membership brochure, which includes information about the COC's board, councils, and committees. And if you have any questions, please don't hesitate to contact Victoria Kelly with HLA. And as you see, her email is on the screen, vkelly@hlapinellas.org. So now about our COC sessions. In an effort to help spread awareness about critical resources, the COC will host 4 membership meetings and 8 COC information sessions this year. So as you can see them on the screen of the COC meetings, one was held January 12th, the next one is April 9th, and August 13th, as well as November 12th. The info sessions, which today is our first, so thank you for joining us, February 13th in March, May, June, July, September, October, and December. So the information sessions will cover a variety of topics from senior and veteran services to transportation and housing. During each of these sessions, COC members organizations will present their programs and services, giving you, COC members and supporters, an opportunity to learn about various initiatives within our community, even giving participants a chance to have their most pressing questions answered. Today, we will learn about, and as you can tell, I'm wanting to make sure I get all of the information and I don't skip over anything. But today, you will learn about the Pinellas County Healthcare for the Homeless Program, Empath Health and Empath Partners in Care, EPICS program, the Bay Pines VA, and the Homeless Empowerment Program, Dental Clinic. As the presentations are going on, please feel free to put your questions in the Q&A box. Presenters may be able to take 1 or 2 questions after their presentation, but we will also have an opportunity for additional questions at the end. Of course, a recording of and materials from this information session will be provided after the meeting. Now, I will hand it over to Ms. Victoria Kelly, Senior Manager of Organization and Advancement and Strategy with the Homeless Leadership Alliance of Pinellas, to introduce our partners.
Thank you very much, Council Member. I appreciate that. So as Councilmember Fig Sanders said, we are going to hand it over to some of our partners who will present their healthcare related services. Our first presentation will be the Pinellas County Healthcare for the Homeless program, and Dominique Randall will be presenting. Dominique, are you here?
Yes, good evening, everyone. Dominique Randall, Pinellas County Human Services. So we'll just jump right into it. So thank you all for your interest and for joining us this evening. It looks like a pretty good number of people in the audience, so I'm glad you all are here. I'm going to spend some time just talking about Pinellas County Human Services, specifically our Pinellas County Health Plan, as well as the Healthcare for the Homeless program. This program is done through, we are the managing for that through the Department of Health. They're subcontracted to do that. So all of these services are provided through the Department of Health, as well as some other community partners. What the overall objective of this, sorry, I had to pop up. But the overall objective of our healthcare program is obviously to help reduce health disparities across Pinellas County. We looked at some of those years ago and said, and we continue to look at those to say, what are the needs of our community? How are we meeting those needs as it relates to their healthcare? Also, we're talking about behavioral healthcare, as well as any substance use or misuse needs that may be going on. We're looking at continuity of care. How do we positively impact that? How do we positively impact the service delivery that we're engaging with individuals, and trying to reduce our emergency room visitations? As you know, that can be quite a daunting task, and also that can be very expensive and costly for individuals. If you've ever been to the emergency room, you know what those costs look like. But to try and to reduce the number of interactions in an ER and overall reducing the amount of healthcare needs to produce better outcomes. By treating the entire person, we're looking at what's called a medical home model. So that's kind of like a one-stop shop where everything is sort of hubbed out of this location. So next slide, please. When we're able to focus on that prevention healthcare, we're able to promote things like a healthier lifestyle, engaging individuals in that medical home to connect them with doctors and other medical care needs. So what we look at for our medical home is we're looking at one of 5 locations across Pinellas County. On our next slide, you can see there was actually a typo on this slide. We actually have 5 locations. Currently, the last one not mentioned is up in Tarpon Springs. So anyone that is eligible for our Pinellas County Health Plan, as well as the Healthcare for the Homeless program, which are 2 very similar programs, are able to access services at one of these 5 sites. I'll get into some additional sites in a little while. The thing that most people call the Pinellas County Health Plan or Healthcare for the Homeless is the Pinellas County Blue Card. If you ever heard, oh, I have a Blue Card, if they're trying to access healthcare, that is typically what we're looking at for this Healthcare for the Homeless and our Pinellas County Health Plan. Sorry, if you'll go back one more. So with our eligibility for the Pinellas County Health Plan, this is for any individual that resides in Pinellas County. So not just those that are experiencing homelessness. What we're looking for eligibility on this is proof of identity. We do need to verify who you are, your age between 18 and 64. And that's really just to make sure that we are the appropriate health plan for that individual. What their residency is, they do need to be a Pinellas County resident, as well as their citizenship. It does require U.S. citizenship. Our income currently is at or below 100 FPL. What that means is an individual has to be making, a single person has to be making less than $12.55 under the new current rates. So if an individual is receiving less than $12.55 a month, then they would be eligible for the Pinellas County Health Plan. We also do look into assets, and those assets for an individual are actually at $3,000 for an individual, $4,000 if they're a couple or a larger family. And these again are for your adults in your family that may be needing to connect with healthcare services. So we are going to try and roll out alternative health benefits. We have the VA here. That's a great example. If they're going to be more appropriate, if they're eligible for VA benefits, we want to make sure that they're linked up with the right service that will best meet their needs. This is a 12-month program with the opportunity to renew annually. And what that does, next slide, is the Healthcare for the Homeless program, which is kind of what you were talking about today. It's the exact same program, plus a few other things, is that all we're looking at is proof of homelessness. That can be self-verification. They have to be within that same age bracket of the 18 to 64, and also ruling out if there's alternative insurance. That would be the primary, essentially. When we're looking at that, is we're really looking at, okay, is this person stable? So when we're looking at the proof of residency and the proof of homelessness, we're looking at, because this person could potentially be couch surfing. And if they're presenting that they are unstably housed, we are not going to be doing those confirmations on things like income and assets. This program, again, is a 12-month eligibility. So if that person is housed on month 2 or 3, they don't automatically get kicked out of the program. They are eligible for another year to help transition them out, to try and help stabilize and try and stabilize them in that location. Some of the services that these two programs offer, next slide, please, is primary medical care, cancer screenings, wellness visits, and prevention services. Again, we're really focused on the prevention services. If I can stop the emergency, we don't want the emergency to happen in the first place. That's really the intent of this program, the wellness and prevention services. We also offer physical therapy, mental health services, and substance use services. We do those in partnership with Directions for Living and Operation PAR. Pharmacy services, we also do referrals for dental services through Department of Health. And we do all of these lab medical services, case management, telehealth, and bus passes. One of the best things that we've added in the past couple of years is our telehealth services. So anybody can do that from their own phone. We also have satellite telehealth locations throughout the community. For instance, we have them at Department of Health. We have them at our Pinellas County offices. We have them at Operation PAR and a few other locations so that people can go to those locations if they're not able to get to one of those 5 sites mentioned earlier to have that visit, or they can do it from the comfort of their own smartphone or Wi-Fi enabled device. It does require, you can't do it at a library because it's a medical visit. So we do require, that the HIPAA and the confidentiality. But if that person is in the park and has enough social distance and they're comfortable in that space, they can do a telehealth visit right there in the park. It also has a perk. This one is always a favorite in the community. It does help with bus passes. So right now, you may be familiar with the disadvantaged bus pass. That disadvantaged bus pass allows someone who is an $11 monthly bus pass. This one cuts it down to $6. So they could go ahead and utilize, instead of getting that $11 monthly disadvantaged bus pass, the TD bus pass, they could get it for $6. Or if they're not interested in that, they do still have 10 free days that they are able to utilize throughout the month with that, the blue card and the bus pass. Scripts are filled at many of your traditional locations, Publix, Walgreens, Walmart, CVS. There's also a few private places, pharmacies throughout our community. And then as well as some of our medications are also done through Directions for Living, as they have their own pharmacy on site. And how much does this cost? Free. I haven't really mentioned that. So there's not copays, there's not fees for exams, or scripts. There's very limited fees for some of the scripts actually as it relates to basically what are those that are medically medical necessary. There's a whole formula for which ones are allowable or not allowable, but any of your generics are going to be covered through this script. And again, this program is completely free for the individual that's eligible. So for any of our homeless individuals, 18 to 64, we highly encourage getting connected with our Healthcare for the Homeless program. So we talked about our 5 locations: Tarpon, I believe it's Clearwater, Pinellas Park, St. Pete, and kind of mid-county Largo area. What we do, Bayside Health Clinic has been in operation for the past few years in basically neighboring Safe Harbor. So right up on next to Safe Harbor, there's a building there that's been open for years. We actually are under remodeling that right now and working on doing an expansion. That expansion is going to more than double the size of that space. And also there's dental provided there, adding a 3rd dental chair, being able to house a lot more staff and a lot more offices. So that clinic is temporarily relocated to our Elmerton clinic. So you'll hear us say Bayside Clinic is kind of the medical home for the Healthcare for the Homeless program. That's the main offices. And right now they're relocated for Mid-County. We're looking at, I believe it's a late summer, maybe fall reopening of that location, but there's been no service interruptions as services are provided over at, we're calling it kind of Bayside Elmerton. So, and that again, will bring an additional 2,000 square feet. You can see our office hours listed here for that program, which we try to, it's great. We have weekend hours. Most of my providers don't offer that for nights and weekends so that we can, again, really be available to the clients. For fiscal year 2022, we served 2,264 clients that all had some sort of medical encounter. So that was not just eligibility, I have a card, it was actually a visit. As well as this year, we have seen over 2,525. So we're doing a slight increase on the numbers of individuals served. And honestly, we have the capacity for much, much more. So please bring this home, share this resource, let people know that it is available in our community. We also provide, we talked about being connected and having access. We want people to have open access and we want to break down barriers. One way we do that is through our mobile med unit. Excuse me. Our mobile med unit is a large RV camper. I don't know what you call this, truck, bus thing. It is actually in the works of getting we're working on getting a new one. This is a pretty old vehicle that we currently have out on the road. So sometimes it's offline, but we are providing services at those locations, whether the bus is there or not. So you'll see a real small map here, but essentially we spend Mondays at Safe Harbor because of the temporary relocation. Tuesdays we're at St. Vincent de Paul and St. Pete. Wednesdays we're at Pinellas Hope. Thursdays at Salvation Army, ARC, which is over on like 66th Street and just north of 54th Avenue North. So kind of that northwest St. Pete, as well as Friday Salvation Army in South St. Pete, the shelter down there. So again, we're trying to open up accessibility so more people are able to access that. If you just type in Pinellas MMU, that one of your first links is going to be that calendar, because of course there could be adjustments to the days, but essentially you get the idea that that's really kind of the same. We keep to the same schedule to try and increase that continuity of care. Next, we also have a street medicine van, and that actually has a video to kind of self-explain itself. So I will silence my mic and you all can hear about our street medicine van.
Oh, sorry, everybody. I didn't realize that I was video sharing. Give me just a second. I need to reshare my screen there so that you can hear that audio, because you're not going to hear it right now.
Street medicine is so important in our community because it brings clinical services to those who are unsheltered. And so for many years, we have operated the Bayside Health Clinic, as well as our large mobile medical van, where we bring services to a location and people come to us. And this one really is different. So we are going out in the community, we're going and finding people who are living unsheltered and meeting with them, building rapport, and offering clinical services to keep them healthy and keep them alive. We have great partnerships for the street medicine team. So we primarily work with the Department of Health. So they are the clinical team. So the nurse practitioner, the nurses, the family support workers, they are employees of the Department of Health, where they can provide all of the primary health care. And then we also have a partnership with Directions for Living, and they provide access to behavioral health care services. And then soon we will have telehealth on the van with Operation PAR, so that we can link individuals who need substance use care to that provider as well.
Street medicine actually found me. They go around to different parks where the homeless people are, and they like to make sure that everybody is offered any kind of medical assistance they need. And when they found me, I was in desperate need. They were very open and honest, and they cared. They cared that I was a person and not just a homeless person.
We are out in community, so you may see the van at a park, you may see the van at a bus stop, you may see the van behind a building where people are living. And it's really about that engagement. So it's engagement in medical care, and it's also engaging them and talking to them about their living situation and maybe helping them get into a safe shelter.
Without this, I would maybe dead. They kept at it, they keep coming back, they want you to get the help you need. Now I run to the van. So I just love them. Everybody needs a street team,
All right, thank you, Victoria. So she also put in the chat the link for our application for the Healthcare for the Homeless program in the Pinellas County Health Plan. You can also go in person. I'll put those addresses in the chat. I don't believe they're included in this PowerPoint. And there's also some QR codes that I've had throughout these slides that will direct you to our website, both where the application is, where our locations are that you can apply in person. You also can apply if you're connecting with the street medicine team, the MMU, and the at Safe Harbor. We all have staff on site at those locations to help get people enrolled in this program. So I already mentioned telehealth, so we'll go to the next one, which is our disability advocates. And this is a program it is a benefit, so to speak, of the Pinellas County Health Plan and Healthcare for the Homeless. For those individuals that are participants in our Healthcare for the Homeless program, if they meet these conditions, if they're applying for disability, we have disability advocates that help them with that process. And so they have, if you're familiar with the SOAR process, it's something similar to that, where they have a direct connect to the Social Security office to help advocate and advance those claims. There's no attorney fees. There's no payout fees. This is going completely 100% to that individual if awarded. And they also will, when they determine eligibility, they will say, whether or not they're not going to string people along, like some programs that I've worked with in the past or that I've heard of in the past. They really are going to understand, does this person have a claim? Can we work on getting this person through and making sure that we maximize their benefit? To really, again, to increase long-term sustainability, get people stable, and reduce health disparities and improve health outcomes. So again, you have to be a Blue Card or Pinellas County Health Plan participant, have a disabling condition that impedes your ability to work for a year or more, and not have an active Social Security claim. So if someone is already engaged in that, they are not able to then switch over to our DA, our disability advocates. How to apply? That's what I was talking about. Oh, I do have the addresses here. So here are the addresses to apply in person. You can apply over the phone. You can scan that QR code. It will bring you to that website on the bottom right. Or, like I said, go into one of those two offices in person. And so all of that to say, thank you for this opportunity. I know it was a lot to kind of throw out all at once. I think we have opportunity for a question or two now, and then maybe some more questions at the end.
Yes, Dominique, it looks like we have about 3 minutes for questions. An easy one came in to me privately. Could you please repeat the number of clients served last year?
Oh, goodness. Okay, let's see. 20 or 2000. So the last fiscal year was 2,525.
Thank you very much.
Yep.
Okay, so there was also the first question that came in. Is there a sliding scale if FLP is over 100%?
No, there is not. So at this time for the Pinellas County Health Plan, if the person is housed and stable, then they have to follow that FPL of 100%. We do not have any adjustment on that at this time. However, if they are homeless, if they are unhoused or not stably housed, then the FPL is not relevant.
Thank you very much. Our next question, is this only for citizens or are green card holders also eligible?
And I am actually gonna phone a friend. I believe Judy is in the call today. So we were talking about this earlier today. So I believe it is only those with full citizenship. Judy? Giving her time. We might have to come back, let her on mic.
Okay.
Okay, so I believe it is only for those that are citizens with those with
Can you hear me
but-
now?
oh, there
Yes.
she is.
I'm sorry, I messed up the computer. You can't see my face either, but some green card holders, yes, can come in.
See, that's why I phoned a friend. Some green card holders.
Sorry, I've
So-
been listening, but my picture and my mute thing went off. We do not help people that are that are brought in by their families, that they've agreed to take care of them. And with their special things, there's many people that come in as refugees. We help them. But it really is on a case by case basis. And if you have a question, have somebody please just have them apply, and our case managers will talk to them. What is the thing that I'm trying to think of? And I'm so sorry. If they're citizens anyway, if they're brought, it's called IR, which is immediate relative. If they're brought in by their families, then they're supposed to be taking care of them. But we look at every single case, and sometimes people have been working for 40 credits. We let those people in too. We're really trying to be kind and decent with people. And if somebody's come into the country and they're not here legally, and they're, like Dominique said, if they're couch homeless or they're staying with the family and they're not stable, they can go through our mobile medical or Bayside.
Absolutely. I also noticed, so I think that answered that question. The next question I saw is, are people over 64? And this is also applies to those that are over 100% FPL, if they're deemed ineligible for whatever reason. We, of course, are going to make referrals to other programs, healthcare navigators. We may not be able to assist directly, but we are going to make those referrals. There are a lot of healthcare navigators in the community. We also at Pinellas County have one health navigator that helps us with our the open market with, formerly Obamacare, with our so that person is eligible if there's a situation change that someone might be eligible. They might be over income for one of our programs, but be able to connect with Erin Richards. She has a lot of good work there. And Gwen, if you want to send me a direct chat with your email, we can make connections on getting you flyers and resource cards and all of those good things.
Thank you very much. Thank you, Dominique, and thank you everybody for those great questions. If you have continued questions for Dominique, please put them in the chat or in the Q&A box. Dominique can continue to answer your questions there in the Q&A throughout these presentations. And we will again have opportunities for more questions at the end. With that in mind, I would like to introduce Miss Trudy Beeler, Veterans Community Partner Specialist with Empath Health, and Alejandra Arias, Lead Housing Case Manager with Empath Partners in Care, EPIC, to present their programs.
Thank you so much. Can everybody hear me okay?
Yes.
Wonderful. So good evening, everyone, and thank you, Victoria and the COC, for the opportunity to be here tonight and share some of our services and programs available here in Pinellas County. I think there's going to be a lot of great information that you may not already be aware of that we're hoping is going to plant some seeds and connect some dots that as you have clients and families coming through your services, we can connect the dots to get them to some supportive healthcare programs that we offer. So next slide. Okay, I came across this article today. The link is at the bottom, and it was referencing homelessness and the impact that that can have on one's health. So the first bullet point, inadequate access to affordable housing can lead to housing insecurity, which causes stress and material hardship, both of which can lead to adverse health outcomes. And then conversely, poor health can result in high medical bills and lost income, thereby leading to housing security. So it's a bit of a vicious cycle. If someone has existing poor health, you know, we've heard those horror stories of expensive medical bills, ER bills, lost income through inability to work or caretaking for a loved one or a family member. So it's a vicious cycle. You know, what comes first, the poor health or the homelessness? They can really impact each other. Compared to low-income populations with housing, people experiencing homelessness can have a higher prevalence of acute and chronic physical and mental health conditions and higher mortality rates. Research has shown that homeless adults experience accelerated aging with premature onset of chronic medical conditions, functional and cognitive impairments, and high rates of age-adjusted mortality. And then finally, people experiencing homelessness sometimes report that health crises, either their own or those of a household member, precipitated their housing loss, in many cases indirectly through income loss. So if we could go to the next slide, with those bullet points in mind, you know, Empath Health we're a leading nonprofit healthcare provider here in Pinellas County. Most of you will be very familiar with our Suncoast Hospice program. We've been the hospice provider in the county for over 40 years. So I definitely want to talk about our hospice program. I want to talk about the second bullet on the left, the elder care services. That's our Suncoast PACE program, as well as our new veteran-centric adult day center. I'm going to briefly this evening talk on advanced care planning, as well as grief services and the resale stores just really quickly as well. And then Alejandra is going to talk about the fantastic EPIC HIV and sexual health program that we have. So when it comes to hospice care, when you're having a client come in and they're dealing with a chronic or advanced illness, so perhaps they've received that diagnosis and treatment is no longer working, I want to let you know that regardless of where a client or a patient is housed, we have the capacity to care for them if they meet admission criteria for hospice care. At one of the Bay Pine stand downs for veterans, I encountered a homeless veteran. He was the caregiver for his wife, who was coping with Parkinson's disease. She was bedridden. They had been housed in temporary hotel accommodations. I met him in the rain on a Saturday morning. By Monday, she was receiving hospice care, and that veteran, as her caregiver, was receiving the support that he needed. So I want you to rest assured that as you're navigating folks through their healthcare journey, even if they are unhoused, we do have the ability to pay to care for them. Regardless of insurance or ability to pay, because we are a nonprofit, our foundation works very hard to ensure that we can care for any patient needing hospice care regardless of ability to pay. I want to touch on PACE. Our PACE program, for those of you that are familiar, is located in Pinellas Park. I want you to think of the PACE program as either a wraparound care when you've placed somebody. So you've worked hard to take someone who had been experiencing homelessness, you found housing, but they're dealing with chronic and advanced illness. They may be a great candidate once they are housed for our PACE program. We can help them navigate their Medicaid application, so it is income dependent. And the senior does have to be 55 plus and exhibiting a need of needing a care assistance with their activities of daily living. So for the seniors that you are housing, PACE is a fantastic option. It has the adult day center. It has light housekeeping. We have home health aides going in to help with bathing, dressing, grooming. We have food services. So this is after the hard work has been done of finding the housing, we can wrap around support for that senior in the home. If you think about it on the flip side, you know, perhaps the senior does have a chronic advanced illness and they're struggling to pay and manage the expenses of their health care, and they're on the verge of becoming homeless or at risk of becoming homeless. You know, a timely call to the PACE program could enable them to be a part of that program to head off at the pass the potential of becoming homeless. I'm going to talk really quick about advanced care planning. Anybody over the age of 18, regardless of whether they're housed or not, we should be considering our living will and our healthcare surrogate. We do provide that documentation free of charge and can facilitate plans. I've worked in the past with HIP, and we've done advanced care planning with their clients. So certainly anyone that is interested in that, it is at no charge to them when we provide the documentation, and we're happy to come out and do that with your teams as well as your clients. Want to talk about grief services. For those of you familiar with hospice care, once a patient passes on hospice, that surviving family is going to get 13 months of free bereavement care after the passing of their loved one. However, for an unexpected loss through medical events, suicide, vehicle accident, we do have our community counseling, which is available for folks navigating unexpected loss and grief or a new diagnosis. So perhaps a client has received a new healthcare diagnosis, such as a cancer, and they're having that anticipatory grief. That's also a service that we can offer. Resale shops, I'm happy to bring coupons to your team. We have 3 resale stores located through Pinellas County. For those of you who love to thrift, we graciously accept donations to our 3 resale stores. One is in Diston Plaza, we have another on Boucher, and then one up on US 19 by Countryside. These may be a great option as you are housing your folks and they're looking to get set up with household goods and items. That we do have a 25% off coupon that they can certainly go on in and take advantage of getting household items, clothes for interviews, things like that. So I can certainly deliver some of those coupons. Next slide. Kind of like Dominique said, it's a lot of information. I have only really scratched the surface tonight. So if I can leave my portion of the Empath Health chat tonight with these 3 key points. When you're working with someone, whether that's one of your clients or it's a friend or a neighbor or someone in your church or your congregation, when somebody is talking about dealing with chronic or life-limiting illnesses, Empath Health has a program that may work to help them navigate that. Grief and loss, whether that's for your clients or again, your friends, family, neighbors, community, our grief and loss programs are available. And then our caregiver support and resources. One of the bullet points in my first slide referenced loss of income for folks that are caregiving for a loved one. So perhaps you have a family that has a loved one with dementia, and that individual that's caregiving for that person is having to miss work, and then we have a loss of income, which leads to housing instability. Again, if we can head these things off at the pass with things like our PACE program or our adult day center, where we can provide a safe, supervised, engaging space to keep the vulnerable adults or the adult needing care safe while that person is taking care of their work responsibilities, again, it's a solution before we have a need. Next slide. Okay, so we are here when you need us. Our switchboard is answered 24 hours a day, 7 days a week. So for Pinellas and Hillsborough counties, you're welcome to call the switchboard and navigate through to the care navigators with a potential referral or questions that you may have. We have expanded into multiple counties to the south with our merger with Tidewell Hospice. Link here to our website. And then we're happy to come out and do free informational visits and explain our services to anybody in the community. Sometimes when folks are navigating illness, they leave a doctor's appointment with more questions than they went in with. So as folks are dealing with these chronic issues, but don't quite know if they are at the point of needing hospice care or PACE or palliative care, we can come in and do that free informational visits and deep dive into what their care needs are and what program that we have may be the best fit. So a lot of information just on those healthcare programs, and Alejandra is going to deep dive into our EPIC program and how they care for our folks in the HIV and AIDS community.
Hello everybody, my name is Alejandra Arias. I'm a housing case manager here at EPIC, and today I'm proud to showcase a wider range of services that EPIC offers. So thank you for joining me as we explore the amazing support system that we provide to our community in Pinellas, Hillsborough, Pasco, and beyond. So first is, this is our primary services, and first one is, the free HIV testing. So EPIC provide a rapid, confidential HIV testing for free at our locations in Pinellas, Hillsborough, and very soon in Pasco. And also we have the mobile unit around the Tampa Bay area, and clients don't need appointment. They just have to walk in and they can have a HIV test. LGBTQ services. Oh, we are so proud of our EPIC generations. That one was created to respond, to the unique challenges and needs of our older LGBTQ plus residents in Pinellas. We are so proud of this program. And this program provides, linkage to care, local advocacy, and much, much more. Medical case management, of course, we have a large group of medical case managers that, of course, they provide linkage, very important linkage to care, but they also provide a lot of other support services like financial assistance, referrals, food pantries, and more. So when we are talking about case management, we have to emphasize on the intensive case management that we provide through TOPWA. That is a program for pregnant women that they are HIV positive or they have a high risk to become HIV positive. It's an excellent program, and we have an excellent provider here at EPIC. Another, with intensive case management is our MAI, or Minority AIDS Initiative, that provide intense case management to minority population. Medical care with our medical home, that is, our 3050, just here beside this building is our medical home. That is a partnership of EPIC with Pinellas Care Clinic to provide, a high quality medical care to the HIV population. Counseling, we have, our providers that provide health counseling, concentrating on managing the mental health, medication, relationship, and more. Housing assistance, and this is my area, we have a group of housing programs. This program is to assist our clients to get stable housing, but they have to be eligible for the program, and I will be talking a little bit more about that very soon. Prevention and education. We provide HIV/AIDS education in Pinellas, Hillsborough, and also very soon in Pasco County. Our prevention team is a very good team and is available to speak at local school, church, business, and other groups that they request, the service. They also can help planning the health fair, outreach initiative, and much more.
Alejandra, I'm so sorry to interrupt, but we are over time for this segment of the presentation. So if you don't mind, I'll give you just one more minute, but then we do need to move forward to the VA.
No, it's
and
okay.
they're
Okay.
part of the
I
presentation,
understand.
sorry.
I understand. Yeah, and PrEP is another service, pharmacy, and of course our housing program. That if they have any question about more specific about the housing program, I will be more than happy to answer any question. Thank you.
Thank you very much. And if you have questions for Trudy or Alejandra, please do put those in the Q&A. Trudy and Alejandra will be able to answer those while Blossom is presenting. And then we will also have the Q&A session at the end. So Blossom will just push back our Q&A and public comment a few minutes. So Blossom, if you are ready to get started and talk about services over at the Bay Pines VA.
Yes, thank you, Victoria. I've enjoyed both the presentations so far. I learned a lot myself. So thank you for having me. I am going to go over an overview of VA homeless programs and, of course, touch on VA medical care. As Trudy said, homelessness can really lead to a decline in health. So I really wanted to highlight our homeless programs because it's all connected. If we can get them in our programs and then move them into housing and get them off the streets, it's definitely helping with any health crises. So we do offer outreach services at Bay Pines, and it is primarily homeless outreach. But when we are out there on the streets trying to find homeless veterans, the best ones to find are the ones that aren't touching healthcare, that we can also link to the healthcare system. We all get very excited when we find someone for whatever reason isn't touching healthcare. And we don't just, like I said, link them to homeless services. We link them to healthcare services. So we have 8 outreach workers in the community kind of doing similar work. And when I say in the community, I know you guys are all in Pinellas, but we actually cover all the way down into Lee County, Collier County, and over in the Sebring area. So we have 2 social workers down south. And because Bay Pines is so, the Bay Pines area is so heavily populated, we have 6 up here. Our social workers serve as liaisons. I always say any chance I get, we can't do this work to bring people into our healthcare system or to solve homelessness without the community. And we are a healthcare system. We're not, we don't provide social services. So we really lean on our community to do that. We go into contract with our community agencies such as PERC, BOLI, St. Vincent de Paul, HEP, and they actually provide our homeless programs through those contracts that we have with them or through those grants. So our VA social workers are liaisons to the program. And then we have outreach workers that are out in the streets trying to find those that are homeless. So sorry, Victoria, will you go back one slide? So this slide, and if you can't, no big deal. I know it. So the slide that she was just on is actually just a quick snapshot of kind of every single homeless program that we are contracted with for shelter programming in the community and the liaisons that are attached to each of that program. Also on site, we have a program called our domiciliary, where we will shelter veterans and rehab them. We offer mental health groups while they're here. We get them the health care they need while they're in that program right here on site. And then we can help them find a permanent housing and get them back to work. All of our contract shelters, you do have to be eligible for VA medical care. You do not need to be eligible for VA medical care for all of our homeless programs. So I love Dominique's presentation when she talked about what Pinellas County is offering, because we do get veterans in our homeless programs that we can't link to our healthcare system. So it's good to know that there's another resource. So just kind of going to go through real quick kind of what each of our contract shelters looks like, what the process is of how we do get them then connected back to VA healthcare. So one of our contract shelters is at St. Vincent de Paul. All of our contract shelters are short-term, 30 days, 60 days, 90 days. St. Vincent de Paul actually just changed. I need to update that first bullet under requirements. They are now accepting male and female veterans into our contract shelter, which is awesome because we are seeing more and more female veterans in need. None of our contract shelters except one, and I'll go over that, has an income limit or a charge. And we see veterans that have high income. Maybe they're service connected, so they're getting paid for their service connection, but they still really need the wraparound. When we place them in shelters, they're not just there to shelter. Like I said, it's full wraparound. There's a liaison attached that's making sure that they are assigned a primary care doc. And if they're not, let's get them assigned. Let's get them into an appointment. Or if they are assigned a primary care doc, they're seeing their doctor, making sure they're engaging with healthcare or mental health, helping them connect to the mental health. VA offers healthcare, mental health counseling. We even have employment specialists here. So when they go into shelter, we make sure they are connected to all of those programs. You see the bullet down there at the bottom of St. Vincent de Paul, a low demand model of care. And what that means is we lower our demands. We don't want to require full sobriety to come in our programs or that they are willing to be engaged. Of course, we're always using our motivational interviewing, trying to get them engaged in their mental health or in treatment, but we don't demand it to shelter them. We want to get them sheltered and then wrap that service around them. And St. Vincent de Paul does a really good job at taking everyone really that needs it. And if they have relapses while they're in there, really working with them and trying to keep them sheltered there while we work through the other concerns. SCMI is located at one of our other partners, Homeless Empowerment Project. They're going to speak later, I think, on their dental program. They offer a little longer shelter contract with us, 90 days, because they do have to have a mental health diagnosis to go to this contract shelter. And next slide. And then this is our most unique shelter program. This is offered through BOLI. Some people call it Safe Haven. Some people call it BOLI Morningside. You'll hear people call it different names. This was originally a national pilot. This was part of the pilot many years ago and now has become a full program. And it is really the model of low demand. Safe Haven will take the most difficult to reach veterans, the ones who've been chronically homeless on the streets, the ones who do have the severe mental health diagnosis or are in relapses, and they do a great job. They provide a single room. They get their own rooms there that way. If they do come back intoxicated, they're not allowed to bring substances on site, but it is a DAMP program, so they can come back intoxicated, but they do have their own room, their own space that they're directed to go into, so it's not harming the sobriety of others around them. And again, they do a great job with that. You can actually skip these next two. These are our Bradenton and Charlotte shelters, very similar to St. Vincent de Paul down south, 30-day shelters. I want to make mention too that all of our shelters, whether it's our 6 months at Safe Haven, our 90 at HEP, or our 30 at St. Vincent de Paul, we do give extensions. If they're doing what they need to do and they get to that 30-day point and they haven't found housing because the housing market's difficult or there was something in their background that prohibited them from going into an apartment, we give them extensions based on the progress that they're making. So it's not like a dead set 30 days. And we can also move them into transition them through other homeless programs if they're not, making it in the time that shelter contract allows. So these are all of our liaisons that are attached to the programs. So they're a good starting point. There's a lot of points of entry into our homeless programs. The HLA is actually a point of entry, getting an access point and getting them into contract shelter. We are directly a point of contact of getting them into shelter. But here, Michelle's a good contact to really assist. And then, of course, my information, my cell phone's always best. We're actually in the middle of like shifting offices, so my cell is much better than my extension. And then I just want to mention, it's not on my presentation yet because it's not totally to fruition, but I honestly think in the next 30 days, we are going to have a really exciting shelter contract, and that is going to be a medical respite contract. So we have found that we have an aging homeless population, those with many medical needs that just can't be served in our contract shelters like St. Vincent de Paul or HEP. A lot of times those programs, they don't have the staff with the medical expertise or the comfort level to serve a veteran who's getting wound care or who's going through chemotherapy. So we did a solicitation several months ago for someone to go into contract with us for what we're calling a medically needy or medical respite shelter contract. And we are in the middle of inspecting that contract. So I'm super excited. It's definitely a gap that needs to be filled. So again, those veterans will need to be eligible for medical care. The program's actually going to be run by nurses. So again, that comfort level will be high. They will take those that are medically needy, who we may even need to transition into an ALF. All of our homeless programs, we like them to go in, and the goal is permanent housing. If they wind up in a medically needy contract and we need to transition them to ALF, that's going to be a little more acceptable than our traditional shelter contract model. Another thing, and I do have more slides, but before I get to that, another thing not listed here, it reminded me when Dominique was speaking, we also have a medical mobile unit. Again, brand new program. We've done just a couple of visits with it. And different from Dominique's medical mobile unit, it's only serving veterans who are healthcare eligible. We've been to Williams Park, and although there were a lot of homeless, we didn't find any homeless veterans, which kudos to everyone out there doing outreach, right? Because they're not in the park. We're bringing them into our program. So that's pretty amazing. Most recently, our medical mobile unit visited the St. Vincent de Paul area. We were hopping and busy there, and there were a lot of veterans hopping off and on the bus. So we're still working on partnerships to make a schedule, and I can get that scheduled to, through Victoria to all of you on the call once we formalize more stops and spots. So that's new, and that's an amazing thing. So I talked a little bit about our domiciliary program, what you'll hear us call it TRRC, Therapeutic Residential and Recovery Center. And again, just that provides short-term residential stability. Although you have to be psychiatrically and medically stable, it's a treatment program. It provides rehabilitation, like I said, and mental health groups. You have to have some rehab goals to go into the program.
And then Blossom, I'm so sorry, but I do also need to give you just a quick 1-minute warning as well.
That's okay. The next few slides go over our grant and per diem programs, and I can wrap this up pretty quick. So grant and per diem, again, also partners with these great names you see in front of us in the community. They give our veterans a little longer length of stay than that short-term shelter contract. They're allowed 3 to 6 months there. So the veterans that need a little more wraparound, the ones that we know, hey, they're not going to resolve in a 30-day shelter stay, and they do need that clinical wraparound, this is where we ask them to go. And I also want to let you know, the veterans who are in these programs, the beauty of grant and per diem, they do not have to be eligible for our healthcare services. They can be what we call humanitarian veterans, meaning maybe they served but didn't serve the 2 years to make them eligible for medical care. Or maybe they served and they didn't have an honorable, but they had like a general discharge. They cannot have a dishonorable discharge. And again, here's our points of contacts for grant and per diem. And like I said, as soon as they hit these shelter programs, we are getting them registered with the VA healthcare system, and our outreach workers are out there looking for those who need registered with VA healthcare. So this is my contact if you guys have any questions or find someone who's a veteran that needs connected to VA healthcare down the road. Thank you, guys.
Thank you so much, Blossom. I really appreciate that. And everybody, please put your questions for Blossom in the chat. And then we should also have Miss Stephanie Vega with the Homeless Empowerment Program Dental Clinic joining us. Ms. Vega is the director of the Homeless Empowerment Program Dental Clinic. Are you on with us, Stephanie?
Yeah. Yes, I'm on with you.
All right, show is yours.
Hi, everybody. My name's Stephanie. I'm the director of the dental clinic. We provide, let's see, I don't know. Okay. Our mission of the HEP Dental Clinic is to provide free, quality, comprehensive dental services to uninsured and underinsured homeless and at-risk individuals residing at HEP and our community partners, regardless of their ability to pay. Okay. And our vision is individuals experiencing homeless in our community have access to comprehensive dental services, thereby decreasing the use of emergency room for dental visits, reducing oral health disparities, and improving quality of health. And what that means is that, we have access to take in individuals with toothaches or teeth that can be saved instead of sending them to the emergency room where, they're going to get medication or they're going to have it extracted. So having them come to our clinic, it reduces the amount of times they go to an emergency room. We primarily focus on those who reside with us, our clients at HEP, families, emergency shelters, and veterans. They do need to fall in our guidelines of 200% below poverty level and those without dental insurance. Vets some are 100% vested, so they do have to see the VA hospital for that. We get our referrals through the community free clinic. They screen patients and then they refer them to us as well as the county. The county supplies us with one dentist and one hygienist. So the county, if a person needs a root canal, we have the ability to do the root canal at our clinic, and then the county pays for that person's crown. Partnering with the county helps us with supplies. So that's our partnership with them. We don't take walk-ins. However, there's always that one person. And so, if somebody's in need and you've, relinquished all resources, call me, maybe I can help you out. Because you also have the community dental clinic, Clearwater Dental Clinic. They take people, they're just strictly a dental clinic. We're also a homeless shelter, which the puzzle piece is dental and wellness. So we have an ophthalmologist, we have a wellness team. So it incorporates everything for those people to help them to help themselves. Sorry, I'm dealing with allergies, so I'm a little bit sniffly over here. We have about 20 dentists who are volunteers. And then if we can't do the care at our clinic, we refer out. I have 5 partnerships for oral surgery, endo, and periodontal work. And most of my dentists have 40 plus years experience. So we pretty much do everything from crown, bridge work, restorative, dentures, partials, full mouth extractions, everything. It's an amazing dental clinic. I'm proud to be there. We just got a grant, so we have digital technology now, so we can scan for restorative work and send that into the lab. So that's a good plus. And do you have any questions?
Well, thank you so much for that. We do appreciate all of the presentations. Those were absolutely amazing. And I know that the audience has a few questions, so let's answer a few, since we don't have any now. Let's just answer a few questions before we give the group an opportunity for public comment. Please put your questions in the Q&A or raise your hand. Victoria, do we have any questions?
We did have one additional question come in from a Miss Mosley. Blossom, you'll be excited to hear this question. Blossom, if we would like to contract with the VA to provide housing, how do we get started?
So you're able to contract when different solicitations or NOFAs are released. So we do that through, like the last time we had a solicitation, you know, I spread it as widely as I could. The HLA assisted me in spreading that word. We don't have anything right now, any new NOFOs or solicitations, but we definitely spread that word through the community when they come out.
Excellent. Thank you very much. Regarding the HEP dental clinic, so folks can be referred through the Clearwater Free Clinic. Do they just go in and do the referral and ask for a referral that way? How exactly does that work?
I think it's a medical clinic, so they see a physician. So if they have any issues with dental, then that's where the referral comes from. So they write the referral, it gets faxed to us, and then we contact the person. The one thing with our clinic is because we're not for profit and our dentists are strictly volunteers, you know, we will call the person and call them again at least a couple times. We don't chase the person down. But if they do miss 2 or more appointments with no call, no show, we don't have to accept them back. You know, it is teaching responsibility with that. With those that live on our campus, you know, with dealing with the case manager, a lot of times with anybody, their health is secondary, third or fourth. So it's establishing, again, responsibility, taking care of your health. So just because they missed 2 appointments, I mean, we talk to the case manager because there could be more than just dental and not making that appointment. So it's a holistic approach. I mean, I don't just throw the ruler on them and say you didn't make it to the appointment. I really try to open up the communication, even from an outside source, because many people have trauma with dentistry, period, and that's why they're not going. So we do have our rules and I do stick with them. But, you know, with anybody, there can be that one person that, you know, needs to get through anxiety and getting into the dental office. So we're very open to that. And I'm very open to that and working with that person.
Okay, awesome. Do we have any other questions?
Yes, Don Suriano with PIMS is also just wants to clarify about referrals to the HEP Dental Clinic. There are no self-referrals for that. The way to get referred is either to be a HEP resident or through the Clearwater Free Clinic, right? Are there any other methods of referral?
The county refers to us when the person needs a root canal, and we only see those who are 18 and up.
Excellent. Thank you very much.
Any more questions? Well, having none, thank you. So now we're going to allow audience members. This is your opportunity to share during our public comment section. So in order to share, please raise your hand or type in the Q&A box that you would like to share with the group. Is there anyone out there that would like to share? Because we're actually 4 minutes early, so we're moving right along. Thank you, Victoria, for keeping us on time. So this is our public comment section. And if no one has a comment, we'll actually take a couple of more questions if there are any.
Not yet, but let's go ahead and give everybody a minute in case anybody is feverishly typing.
I'll just make a comment. This is Blossom again. Trudy mentioned our homeless stand down. If any of you have an agency that you think could serve our homeless veterans and would like to be an exhibitor at our stand down, as you heard Trudy say, it really does help. I loved that story that that person, she was able to assist at stand down. We actually just put out the invite, I think it was the end of last week, for our vendors. So if you didn't get an invite from you, it just means for whatever reason you haven't previously been and you aren't on our list. So if that's something you're interested in, I'll put my email and the person who helps me actually organize vendors in the chat, so that you can be considered to be one of our vendors. It's a great event.
That's fantastic. Thank you, Blossom. And I can confirm that is a great event. Our veteran services team goes, I think, every time. They always have a blast. So go join them. And then we do have one hand raised. Tina, do you want to come off mute and ask your question or share your comment?
First of all, I'd like to thank you. This was very informative. We work with everybody in Tarpon Springs for social service cases, so we see all ages. And I know there was a question in the question and answer, but I didn't see it answered as far as receiving flyers, or I know the card had a QR code to where we can also attach that to the forms that we hand out to people that come for services for us, where we would be able to get that information.
Which form with QR code? Do you mean for the healthcare for the homeless program?
Yes, I think it was to where they can actually sign up if they're eligible.
Absolutely. So if anybody would like any of the little healthcare for the homeless flyers or handouts, please go ahead and put that information or request in the chat, or let me know, and we can share your information with Dominique Randall, and she can work on getting that to you. I will also, Dominique has just put her email in the chat. If you would like any of those resources from the healthcare for the homeless program, any of those handouts, please go ahead and reach out to Dominique. Her email is in the chat, and she will absolutely enthusiastically share those with you, because it's really important that the community know that those services are there. So thank you very much for asking for that and for sharing that.
So do
There's
we have no more?
There was a note in the chat to consider adding occupational therapists to some of this outreach. So I'll share that, and then let's see the Q&A. In regards to the dental clinic, what if a client is assigned to another medical care home, such as the St. Pete Health HD, I think that's health department? Can the referral be generated from there, or does it need to come through the Clearwater HD health department directly? I think that's for you, Stephanie, but Dominique,
Depends on what they need. If the county can't take care of what is needed at the county, then they refer out to their partnerships to take care of what the need is. Some of the county dental doesn't do root canals, so then they have their doctor at another facility, and then those people will go there and get the root canal done in the crown, but the restorative, like fillings or extractions, would be done at the county. So,
Yes, and when she's in the county, we mean with the
like Pinellas
Florida
County
Department
Health
of Health.
Department.
So the Florida Department of Health does provide dental as part of the Pinellas County Health Plan. So there are Department of Health referrals that are made over to HEP. And they're not a direct referral. It's more of like a link to apply for those services. What she mentioned earlier for those direct referrals are the HEP residents, and then the Clearwater Free Clinic, which is a completely separate from the Clearwater Health Department.
And then you have the community dental clinic, which is off of Woodlawn. They're open to the community, so they have their guidelines, but you can also go there Teresa White is the CEO. I took her position. So that is strictly dental there. And also the county has their doctor there as well. So, I mean, regardless, someone, contacts, and with all of us working together, we're here to help the person, and we know somebody to know somebody to get a person in somehow to get what they need.
Okay, let's see. Anything else, Victoria?
Not so far. Is there anything else anybody would like to ask or share? Oh, Dominique did share a flyer in the chat as well that I will, when I send out these resources tomorrow via email, I will share the flyer that Dominique shared. That is for a Healthcare for the Homeless meet and greet event on the 27th.
Awesome. Well, thank you. If there are no more questions, I just want to thank everyone and thank you to all of our presenters because, there is a recognition that is so deserving of everything that you do, because it definitely takes special people to do the services that bring the services that you provide. And I know sometimes it's a thankless job, but we're going to thank you here tonight. Thank you, thank you, thank you for going the extra mile. And as well as I also want to thank, for just taking the time to help us better understand your services. I also want to thank tonight's amazing audience as well. I can't tell you just how much it means to me and the COC board to know that you all are actively support our mission to end homelessness. So with that being said, we will have Victoria send a recording of tonight's COC information session, as well as some of the materials in the coming days. So please be on the lookout for her email. And of course, please don't hesitate to reach out to us with questions. So before we end, I'm going to let Victoria, is there anything you want to close with before we adjourn our first info session of 2024?
I just want to thank everybody for joining us on this Tuesday evening. And thank you so much to our presenters. I sincerely appreciate you taking the time to make sure that the community knows that your services are there, how to use your services, and how to refer people to your services. So thank you very, very much. And thank you to the entire community who came out to learn about all of that as well. Be on the lookout for my follow-up email tomorrow.
Thank you so much. And with that being said, everyone stay safe. And again, the session is over, but our services will continue. Thank you until the next time.
Thank you all.